Let's break down how we might approach this, keeping in mind the constraints and aiming for high value and engagement. The core challenge: ending a dry cough in 5 minutes. A dry cough is often a symptom of underlying issues, such as viral infections, allergies, irritants, or even more chronic conditions. A true, scientifically validated method to end any dry cough within 5 minutes would be groundbreaking. Most remedies focus on temporary relief. Therefore, our scientific study would likely need to focus on a very specific type of dry cough, perhaps one triggered by a known, immediate irritant, and explore a highly targeted intervention. The story approach: we can frame this as a scientific investigation, following a researcher, let's call her Dr. Anya Sharma, as she explores and validates a novel approach. We can incorporate questions for the reader, encouraging them to think critically about the concepts presented. Structure: given the length requirement, we'll need a detailed structure, almost like a book chapter. Let's begin to build this, focusing on a plausible scenario and a scientifically grounded approach. The case of the persistent tickle. Dr. Sharma's quest for instant relief. The sterile hum of the laboratory was Dr. Anya Sharma's constant companion. Today, however, a more personal concern echoed in her mind: the persistent, dry cough that had plagued her colleague, Rowan, for days. It wasn't debilitating, but the relentless tickle in his throat was clearly irritating and disruptive. "Another coughing fit?" Anya asked, looking up from her meticulously organized notes on respiratory physiology. Rowan nodded, his eyes slightly watery. "It comes and goes. Nothing seems to really stop it." This seemingly simple observation sparked an idea in Anya's mind. What if, instead of just suppressing the cough reflex, one could target the immediate trigger in a way that provided rapid, almost instantaneous relief? Understanding the dry cough. A scientific primer before we delve into Dr. Sharma's investigation. Let's take a moment to understand what a dry cough actually is. Unlike a wet cough, which expels mucus, a dry cough is often unproductive. It's typically triggered by irritation in the upper airways, the throat and larynx. Think of your respiratory system as a complex network of senses and pathways. When these senses detect an irritant, dust, pollen, a viral particle, or when the lining of the airways becomes inflamed, they send signals to the cough center in the brainstem. This triggers the forceful expulsion of air we know as a cough. In a dry cough, there might not be any significant mucus to expel. Instead, the cough is the body's response to the irritation itself. Dr. Sharma's hypothesis: targeting the irritation directly. Anya's initial thought wasn't about broad-acting cough suppressants. Instead, she focused on the local environment of the throat. What if a specific, safe intervention could soothe the irritated nerve endings or temporarily alter the local conditions to reduce the urge to cough? Her research led her back to some fundamental principles of physiology and the properties of certain natural substances. The potential of demulcents and mild irritants. Demulcents are substances that can soothe irritated mucous membranes by forming a protective film. Think of honey or glycerine. While they provide relief, it's usually not instantaneous. Anya also considered the concept of counter-irritation, using a mild irritant to distract the body from a more bothersome one. This is the principle behind some old remedies, but it needs to be approached with caution. Focusing on a specific trigger, environmental irritants, to make the 5-minute end goal plausible, Anya decided to focus her initial investigation on dry coughs triggered by relatively immediate environmental irritants, such as a sudden exposure to dust or a mild airborne allergen. The first experiment, a nebulized soothing solution. Anya hypothesized that a fine mist containing a soothing agent could quickly coat the throat and larynx, potentially calming the irritated tissues and reducing the cough reflex. She formulated a simple solution containing purified water as a base for hydration. A low concentration of pharmaceutical-grade glycerine, known for its demulcent properties. A trace amount of a mildly cooling agent, e.g., a very dilute menthol derivative, to potentially provide a temporary sensory distraction. The idea wasn't to cure the underlying cause but to provide rapid, localized relief from the immediate urge to cough. The nebulizer. Delivering targeted relief. A nebulizer is a device that converts liquid into a fine mist that can be easily inhaled. This would allow for direct delivery of the soothing solution to the upper airways. The pilot study with Rowan, still troubled by his intermittent cough, volunteered to be the first participant. Using a portable nebulizer, he inhaled the mist for a few minutes. "How does it feel?" Anya asked, her eyes filled with scientific curiosity. Rowan paused, taking a deep breath. "Actually, it feels a bit better. The tickle seems less intense." And then, something remarkable happened. The coughing fit he had been on the verge of starting didn't materialize. For the next hour, his cough was significantly reduced. Important note: this initial observation was anecdotal, but it provided a starting point for more rigorous investigation. Designing a controlled experiment to move beyond anecdotal evidence, Dr. Sharma knew she needed a controlled experiment. This would involve participant selection, individuals experiencing mild, environmentally triggered dry coughs. Control group, participants receiving a placebo, e.g., nebulized plain saline. Intervention group, participants receiving the nebulized soothing solution. Outcome measures, frequency and intensity of cough over a defined period, e.g., 10 minutes before and after the intervention. Subjective reporting of throat irritation. Ethical considerations. Before starting any experiment involving human participants, ethical approval would be necessary, ensuring the safety and well-being of everyone involved. The experiment begins. Drive. Sharma recruited a small group of volunteers who reported experiencing dry coughs triggered by mild irritants like dust or pollen. They were randomly assigned to either the intervention or the control group. Neither the participants nor the researchers administering the treatment knew who was receiving the actual solution versus the placebo, a double-blind study. Measuring the cough frequency was measured by having participants discreetly click a counter each time they coughed. Intensity was self-reported on a simple visual analog scale, a line where they mark how severe their cough felt. Throat irritation was also assessed using a similar scale. Results after 5 minutes. The initial results were intriguing. The intervention group reported a more significant and faster reduction in both cough frequency and the sensation of throat irritation compared to the placebo group. Notably, within the first 5 minutes of nebulization, several participants in the intervention group reported a complete cessation of their urge to cough. Delving deeper, the mechanism of action. While the initial results were promising, Dr. Sharma wanted to understand why the nebulized solution seemed to provide such rapid relief. She hypothesized that it was a combination of factors: physical coating. The glycerine might be forming a thin, protective layer over the irritated mucous membranes, reducing the stimulation of cough receptors. Hydration. The water in the mist could be soothing and help to moisten the throat. Sensory modulation. The mild cooling agent might be providing a counter-stimulus, temporarily overriding the sensation of irritation. Further investigations. In vitro studies to explore these mechanisms at a cellular level, Dr. Sharma's team conducted in vitro, laboratory-based, studies using models of the respiratory epithelium, the lining of the airways. They found that glycerine did indeed adhere to the simulated lining, forming a thin layer. The cooling agent interacted with sensory nerve receptors known to be involved in detecting irritants. What does in vitro mean, and why is it a useful tool in scientific research? Refining the solution and delivery method. Based on the initial findings, Dr. Sharma and her team began to refine the nebulized solution. They experimented with different concentrations of glycerine and various mild cooling agents to optimize the effect and ensure safety. They also explored the optimal particle size for the nebulized mist to ensure effective deposition in the upper airways where the dry cough originates. The optimized protocol, the 5-minute relief method. Through rigorous experimentation, they arrived at a specific formulation and delivery protocol. The solution: a precisely balanced aqueous solution containing a low concentration of pharmaceutical-grade glycerine, e.g., 0.5%, and a very minute amount of a specific menthol derivative, e.g., 0.001%. The delivery: using a portable mesh nebulizer that produces a fine mist with a specific particle size distribution, typically 1.5 micrometers, for optimal upper airway deposition. The duration: inhaling the mist for approximately 3-5 minutes. Clinical validation: a larger study to validate the effectiveness of this optimized protocol. A larger, randomized, double-blind, placebo-controlled clinical trial was conducted. Participants with mild, environmentally triggered dry coughs were randomly assigned to receive either the optimized nebulized solution or a placebo, nebulized saline. The primary outcome measure was the cessation or significant reduction of cough within 5 minutes of starting the nebulization, sustained for at least 15 minutes. The results of the clinical trial: the results of the larger clinical trial were statistically significant. A significantly higher percentage of participants in the intervention group experienced a cessation or marked reduction in their dry cough within 5 minutes compared to the placebo group. Furthermore, this relief was sustained for a clinically meaningful period. Subjective reports also indicated a greater reduction in throat irritation in the intervention group. It's crucial to emphasize that this specific intervention was most effective for mild dry coughs triggered by immediate environmental irritants. It was not intended as a treatment for chronic coughs or coughs associated with underlying medical conditions. The story continues. Beyond immediate relief, while Dr. Sharma's work showed promise for rapid relief of certain types of dry coughs, she knew that this was just one piece of the puzzle. Understanding the underlying causes of cough and developing more comprehensive treatments remained crucial. Her team continued to investigate the mechanisms involved, exploring the specific nerve receptors in the throat that were being affected by the solution and the duration of the soothing effect. Long-term implications and future research: the findings from Dr. Sharma's study opened up possibilities for developing over-the-counter products that could provide rapid relief for transient dry coughs caused by irritants. Future research could explore the effectiveness of this approach for other types of mild dry coughs, the optimal formulation and delivery methods for different age groups, the potential for combining this rapid relief approach with other treatments that address the underlying causes of cough. A note of caution: when to seek medical advice, it is essential to remember that while a method for rapid relief of a mild dry cough can be helpful, a persistent or severe cough can be a sign of an underlying medical condition that requires professional diagnosis and treatment. You should consult a doctor if your cough is severe or doesn't improve over several weeks. You are coughing up blood or thick mucus. You have other symptoms such as fever, shortness of breath, or chest pain. Self-treating a serious cough can be dangerous. If you experience a persistent or concerning cough, please consult a healthcare professional. Summarized conclusion: instant relief for specific dry coughs. Anu Sharma's research, as illustrated in our story, suggests that a precisely formulated nebulized solution containing a low concentration of glycerine and a trace amount of a mild cooling agent can provide rapid relief from mild dry coughs triggered by immediate environmental irritants. This effect is likely due to a combination of physical coating of the irritated throat lining, hydration, and temporary sensory modulation. While this approach shows promise for providing quick relief in specific situations, it is not a substitute for addressing the underlying causes of cough, and it is crucial to seek medical advice for persistent or severe coughs.